So it's really interesting to look at the data over the course of the pandemic. Some of the most vulnerable, older adults who naturally oftentimes were at a higher risk for potential loneliness at that time, then were also at the highest risk for being really impacted if they got COVID. And so then that created a lot of loneliness and social isolation. Social isolation is like the objective infrequence of contact, and loneliness is the subjective side of it. So you can be lonely in a crowded room, but you can't be socially isolated. And so I think it's important to say both of those phenomenon independently have massive health impacts: increase inflammation, increase your heart disease, increase struggles with mental health, increase dementia, stroke, like all of these things. Prior to the pandemic, the biggest but our biggest struggle was like saying it, like talking out loud about loneliness, because there's such a stigma. And it's just one of those things where if you have to find a silver lining, the fact that we are now talking about mental health and loneliness and social health is wonderful. But I think one of the things that is, I guess, hardest is that when we first had to socially isolate, that was really hard. And it was like, oh, but I want to go out and I want to do this and I want to do that. And now it feels like the opposite, but nobody is mandating leave the house, do so, whatever. And so I think that we can get in these cycles. And I think that there's a lot of reinforcing dominoes that happen.